Hey there, thanks for clicking over to the video. Blake Watts here, Channel Partnerships Leader for Ochsner Connected Health. So the big question, why is a large academic not-for-profit health system out of Louisiana into the whole point solution world, competing with the likes of, the legacy VC-backed diabetes and hypertension management players? So the origin story is actually really interesting. It's part of the reason I was interested in even coming over here to run channel partnerships. So about 8 years ago, the hospital system was wrestling with a problem, and that problem was thousands upon thousands of patients that were struggling to manage their diabetes or hypertension, coupled with a bunch of primary care physicians in our network that were struggling managing those patients as well. So it was a two-sided problem that we as a hospital system, which incidentally we are a leader in value-based care. So we were taking risk in sizable populations in that New Orleans area. We had a big problem to wrestle with. So we spent about a year developing a protocol for managing patients remotely. So clinically managing patients remotely to help them with their diabetes and hypertension. We tested it out and it started working. We expanded it and basically rolled it out as this is our mode of care for anybody that shows up in any patient that shows up in the healthcare system at Ochsner. This is how we treat them. And it worked really, really well clinically. And so we started rolling it into populations of the state of Louisiana with Medicare and Medicaid populations. It worked really well there clinically. And we took a look at ourselves. We have 34-ish thousand employees, and we thought, well, we better drink our own Kool-Aid here. And so we rolled it out as an employee benefit to our 30 plus thousand employees. All along, never intending to launch a point solution, never had salespeople, never really intended for this to do anything other than take good care of our patients in the system. Fast forward a few years, and local companies and consultants down in that region started looking at us and asking, hey, what are you doing? Can you do that for our client? Can you do that for our company? And we just sort of grew by word of mouth. And then just before the pandemic, a large oil and gas company out of Texas reached out and they said to us, hey, we want you to do this for our population, but we want you to do it nationwide. Now, the licensing for this, because this is not remote patient management, it's not just remote patient monitoring. This is patient management, clinical management. So the licensure for that is completely different. And we decided, you know what, if we're going to do this for this one employer in nearly 30 states, we may as well license it nationally and launch it nationally. And that's how the whole thing was born as a national program. Doesn't matter who the doctors are, who the PCP is for our members, doesn't matter where that doctor is, where the company is cited, doesn't matter where the consultant is. We can do this nationwide. So we are now competing with all the big players in that space, all the legacy OG players, and really taking it to them because of some of the unique differentiators we have versus those. I don't have time for those in this video. That's all in our profile here on Benefit Pitch. Please check that out. Please reach out to me for more information, and thanks for checking us out. Have a good day.